At the outset, my heartfelt gratitude goes to the organizers of this particular August seminar, the International Business Conference, as well as GHRT Global Human Rights Trust. More exclusively, the organization was spearheaded by Rahman and its team member for given opportunity to say something about the heart attacks. I'm a cardiologist, interventional cardiologist in Hyderabad. As you all know, despite remarkable breakthrough, I don't take much of your valuable time since morning you got fatigued with various multitude of conferences, might be bombarded, you might be totally mentally constipated, but I will take very few minutes of time, valuable time. So despite remarkable breakthrough in the pharmaceutical interventions, despite remarkable breakthrough in the various operative procedures, interventions, cardiac interventions. Currently, we are doing very advanced cardiac interventions, cardiac therapeutics to mitigate the heart attack related, heart failure related complications to a greater extent. Despite still the heart attack incidence across the globe, more particularly in South Asia, more exclusively in our country, Indian subcontinent, is bargaining by several folds. There, as you all know, there are several triggering factors that contributing to the genesis of massive heart attacks in our country. More particularly, as you all know, for last 3-4 years, particularly in the peri and post-COVID era, you all witness the lot of heart attacks. Many younger population, they suffer and die with heart attack. Despite utilization of advanced life-saving medications, life-saving support systems, and life-saving advanced therapeutic operations in the form of angioplasty, stent operations, pacemaker deployment, despite the mortality is very high. The principal reason, the traditional risk factors like hypertension, more particularly uncontrolled hypertension or inadequately controlled hypertension, as well as diabetes, more particularly uncontrolled glycemic status, inadequately controlled glycemic parameters, as well as dyslipidemia, means high levels of harmful or dangerous cholesterols like low density lipoprotein and high levels of very cardiac harmful cholesterol like triglycerides and low levels of cardioprotective cholesterol like HDL. Along with this, other risk factors like obesity with body mass index greater than 30 kg per meter square body surface with waist hip ratio more than 0.9 in men, more than 0.8 in women, and excessive nicotine consumption. Now it became very, very trendy amongst youth. Excessive nicotine consumption, nicotine addiction, cigarette consumption, vaping, and excess alcohol as a fashion nowadays became very fashion. Whenever there is a party, many youth are hanging out there and they used to take a lot of alcohol. Alcohol in any quantity, tobacco, regardless of the quantity, is extremely hazardous. Along with that, mental stress. You all know that mental stress is the major contributing factor for the development of heart attack in younger population. Excessive mental stress is maybe family related, the profession related, job related, target related, whatever the reason behind the undue mental stress. That is a major triggering factor for the massive heart attack, even in the absence of hypertension, even in the absence of the diabetes, even in the absence of the obesity, even in the absence of the high cholesterol, even in the absence of the family history. So the mental stress or mental agony, mental apathy is a major thing. Why the mental, how the mental stress can cause? Whenever there is a mental stress is there is one gland in the brain that is called amygdala that gets stimulated. There is a pituitary gland that gets stimulated. There is a retinal gland above the kidney that gets stimulated. There is a HPA axis, hypothalamus pituitary adrenal axis, that might get stimulated. Once it is stimulated, there is an excessive expression of very harmful stress hormones. We often referred as, it includes catecholamines like dopamine, noradrenaline, and adrenaline and cortisol. More particularly, noradrenaline and cortisol. There is a catecholamine surge, cortisol surge, in turn due to undue mental stress that can cause remarkable vessel constriction. The heart has very thin, very delicate blood vessels which supplies nutrition and oxygen and various antioxidants, nutraceuticals to the heart muscle to get its healthy function. When the blood vessels, which are very thin, particularly in India, Indian men or Indian women, in contrast to Europeans and American, our blood vessels are very thin and narrow. That's why in our country, the heart attack incidence is threefold higher in comparison to Europeans and Americans. The principal reason, scientifically, the blood vessel caliber, the blood vessel thickness were very thin. Most who were very genetically Asians, particularly Indians, are very prone to, 10 times more prone to the development of heart attack in comparison to westernized nations. And similarly, we are 6 times more prone to heart attack in comparison to our neighboring Chinese counterparts. We are 20 times more prone to our friendly nation Japan. 20 times lesser in Japan, but we are 20 times more prone. Across the globe, particularly in South Asia, every 6 seconds, one person is dying with heart attack. In our country, in every minute, the four our fellow Indians are suffering with heart attack. Perhaps they die despite institution of advanced medications. And every day, approximately according to there is one international data in collaboration of ICMR, Indian Council of Medical Research, All Indian Institute of Medical Sciences, they collaborated with the study, Inter-Heart study. The Inter-Heart study clearly unraveling 900 Indians are dying every day with heart attack. The reason is very clear in our country. The principal reason I aforementioned with the undue mental stress, excessive mental agony, and lack of sleep, at least 7 to 8 hours of sound sleep, NREM, non-rapid eye movement sleep. That means sound sleep is required. If the sleep duration is hampered, if the sleep duration is less than 4 hours, there is a greater propensity to the development of heart attack. The sleep is very important, and mental stress and lack of sleep, these are the principal reasons. Particularly in the people who are working in the software sector, they're working day and night, because the daytime we can work, the night time is a resting period. But what we are doing, but we are not sleep, particularly young people, they are often be hang out at pubs and restaurants till late, 3 o'clock. So internal circadian rhythm, mind circadian rhythm get drastically altered. There is a excessive expression of very dangerous hormones, the catecholamines, that get liberated owing to altered sleepy habits particularly whenever there is a mental stress, altered sleeping habits, excessive tobacco consumption. We all know that in many pubs, there are lot of nicotine, lot of alcohol is pouring, they are consuming, and excessive consumption of imported foods, not indigenous one, imported one. You all know KFC, Kentucky Fried Chicken, looks very tasty and looks very attractive, but it's very harmful. It has a lot of very toxic chemicals that not only can, particularly acrylamide, hydrocarbons, tars, very dangerous chemicals which are found in the fried foods, the KFC, pizza, burgers, tinned foods, canned foods, preserved foods, bakery foods, you name it, anything, packed foods, and excessive processed meat, the red meat, the processed red meat. They're extremely hazardous. These are the food substituents in conglomeration with lack of sleep and excessive mental stress and obesity. Many people are not doing exercise nowadays because our ancestors, they used to work since morning to evening in the fields. My father, grandfather, they used to work in the fields, but we are not working. Many youngsters, they go to sleep by 1 a.m. or 2 a.m., 3 a.m. They will get up by 11 a.m. They start working with the system. So that's why there is no exercise at all. Even children's, once upon children used to play outside onto the playground. Now the children are playing with their mobiles. So because of all these reasons, so the incidence of heart attack across the globe, more particularly in our Indian subcontinent, is doubling or tripling by several folds. So how to counteract? Because the medications, advanced medications, surgeries will protect only 10%. 90% is in our hands. It is possible to prevent heart attack without needing doctors, without needing cardiologists, without needing medications, without needing surgery. 90% of the heart attacks are truly beyond doubt is preventable. How? So we have to change our lifestyle pattern. This is simply change the lifestyle pattern. Simply mindset. Our mindset should be changed. It's very simple. To do regular exercise at least 45 minutes to 60 minutes a day. Avoid undue mental stress. That could be overcome by doing regular meditation, yoga asanas, pranayama, breathing exercises. Excessive consumption of the salt is the major culprit. Salt is not required to our body. Already body has its own salt. Whatever the vegetables you are taking, whatever the food substance, healthy foods, the green vegetables, all greens containing a sufficient amount of sodium, no need to add extra salt. We are unnecessarily buying salt outside and adding to our foods to get more tasty, to satisfy our taste buds. So these to be, if you change this lifestyle pattern, if you avoid all imported food substituents, very dense like pizza, burgers, tinned foods, canned foods, preserved foods, energy drink, cola, beverages, alcohol, tobacco, in any form. You should avoid all these things. Control your body weight. Keep your body mass index less than, if possible, 25.5 kg per meter per square. And waist to hip, this is very important. In our India, it's not the question of the weight. Our weight may be 40 kgs or 45 kgs. But why even thin, lean people are getting heart attack? It is because of the visceral adiposity. Visceral means abdominal obesity. Time. I'll cut short it. Thank you. So, adiposity, visceral adiposity is a major thing. So, that is very important. So, with these measures, we can prevent, if you're able to identify and prevent, control these risk factors, we can prevent heart attack. Okay, these are all preventive measures. Suppose the person has, our fellow person has a heart attack. Next, what to do? We have actually, there is a one heart attack preventive kit is there. This is a heart attack preventive kit. It looks like a small visiting card, credit card. Everyone is carrying credit card, debit card, and forex card. Everyone, but we should carry this card also. Wherever you go, if some of our fellow Indian or fellow human being across the globe, we are all human beings. Everyone across the globe, across the world, we are all human beings. We are all same. We are all one. If any person had the heart attack, immediately, if you give these 3-4 medications, the 4 medicines are there, of which 3 are very important. If you give these 3-4 are medicines immediately, we can minimize or mitigate the complications of the heart attack, and the death rate, incident death rate can be minimized by 90%. 90% death rate can be minimized if you give this tablet within 10 minutes or within half an hour after onset of the heart attack. I explain in 2 minutes I will take. I don't take much of your valuable time because we are all fatigued since morning by bombarding so many lectures, and just 2 minutes give me. This is one tablet. Everyone knows that aspirin or acetyl salicylic acid. It is a blood thinner. It's remarkable blood thinner. If you take this tablet, don't swallow, you just chew it. Once you chew it, the tablet get easily absorbed to the buccal mucosa, that means tongue mucosa. There is a tongue lining is below the tongue, that is a lot of blood vessels. Once you put it inside and chew it, it resorbs, it absorbs, dissolves very rapidly, and the drug will go to the target site like heart. The block is here in the heart. It will go very rapidly within seconds. So immediately the block will get bursted, will get clear, will get resolved. Once it is resolved, the flow, the blood flow, oxygen supply, nutrition supply, everything will get restored. So you can prevent or mitigate or minimize the heart attack to a greater extent by 90% if you chew this one tablet. If you, along with this, there is one more tablet, is that ticagrelor. Earlier we used clopidogrel. This is the ticagrelor, the latest medication. Little bit expensive, but it is more. Clopidogrel, once upon using, that is less expensive, cheaper. This is a better medication. It is a 20 times more potent than the earlier one. That's why combination of aspirin and ticagrelor. If you take these two, plus one more is the statin. This is a statin. It stabilizes the block. It stabilizes the block. Suppose it doesn't increase the block formation, further increasing the block formation. If you take these 3 tablets immediately, within minutes after the onset of the heart attack or the chest pain, it gives you 3 to 4 hours time to reach the hospital. 90% of the patients will not die at that particular site. So a lot of time is available. You have a breathing time. You can take the patient to the hospital, nearby hospital with ambulance, where we can do all relevant rational investigations like ECG, 2D core, and angiogram. Then we can able to identify the block. If block is identified very severe, then we can do stent operation. If it's minimal of block, not required, simple medicines or something. The advantage is that we can avoid stent operations, bypass surgery by 90%. It's beyond exaggeration. It's not an exaggeration. It is proved scientifically with various scientific data. So this my request is always keep this along, these 3 medications in your bag, particularly in your pocket, in wherever you travel. If someone was having this, you give these tablets. So this is immensely beneficial to your fellow human being to prevent very life-threatening, harmful heart attacks. Thank you, sir. Thank you, organizer, for giving an opportunity to say a few words about the heart attack and its incidence and its prevention in amongst youth. Thank you, sir. Thank you a lot.
Thank you.